Today, we're tackling a really big question. We have all this incredible health research, right? Amazing scientific discoveries happening all the time. But how do we actually turn that knowledge into policies that, really improve our lives? That's the challenge we're going to get into. I mean, have you ever wondered about this? You hear about some amazing breakthrough on the news, but then it feels like it takes forever to actually show up in your doctor's office or your local clinic. Well, that delay, it's a huge problem in global health. It's this gap between what we know works and what we actually do. And this right here is the heart of the problem. It's called the knowledge to action gap. And it's such a big deal that even the World Health Organization has made bridging this gap a top priority. The whole idea is to make sure the best, most up-to-date research is what's guiding the big decisions about our healthcare. So, how do we actually do that? Well, the answer lies in this idea called evidence-informed health policy. Now, this is a huge shift from the old way of doing things, which often just relied on the opinions of a few experts. Instead, this is a really careful, transparent process of using top-notch research to make smarter decisions for everybody's health. So, to figure out the best way to do this, a massive international study went looking for answers. They basically set out to find the organizations around the world that are already knocking it out of the park. The goal was to learn from them, to find a kind of blueprint so that others don't have to constantly reinvent the wheel. And believe me, this was not just a quick survey. They went deep. First, they cast a wide net, surveying 176 organizations all over the globe. Then, they zoomed in, interviewing leaders from 25 of the most successful ones. And finally, they did these intensive, on-the-ground site visits with 8 of them to really understand what makes them tick. It's that kind of rigor that makes the findings so valuable. So, what did all that work uncover? Well, the study boiled it all down to 7 key rules for success, a practical playbook for any organization that wants to get this right. Let's walk through them.
All right, rule number 1.
Turns out the best organizations absolutely do not go it alone. They are constantly learning from each other. They build partnerships, join networks, they even go on study tours to see what's working somewhere else. And this is so key, because in a world with limited resources, working together is just way more powerful than working in isolation. Okay, on to number 2. Now, this might sound a little obvious, but the research showed just how critical it is. The strongest groups had these really close, often informal, relationships with the policymakers they were trying to help. It's about building real trust, something that goes way beyond just emailing a report and hoping for the best.
And number 3?
This is where things get really interesting, because it's a bit of a balancing act. Even though being close to policymakers is a huge strength, the study found that being seen as independent was the single most important factor for success. You have to be credible, you have to be unbiased, and that means being super careful about managing any conflicts of interest. And this quote just nails that tension, doesn't it? You have to be a trusted friend to policymakers, but at the same time, you have to be able to be a critical friend. Getting that relationship right, being close but not compromised, is maybe the hardest and most important part of the job. The last 4 rules really complete the picture. You've got to invest in your people, building and keeping a skilled team. Your methods have to be rock solid and transparent so people trust your results. It's smart to start small and tackle important questions you can actually answer. And maybe most importantly, you always have to be thinking about implementation. How will this work in the real world? So these rules are great for organizations on the ground, but what about the big players? Well, the study also scaled these ideas up to create a roadmap for major international bodies, like the World Health Organization. Their role really is to be a kind of global connector. They can link up organizations so people aren't doing the same work twice. They can help take global research and figure out how to make it work in a local setting. And of course, they can rally support from governments and funders. A huge piece of this is creating what they call global public goods, things like shared databases and tools that everyone can use and benefit from. So let's bring it all home. Why does any of this matter to you and me? Well, it's simple. When our health policies are built on the best evidence we have, our health systems just work better. They become more effective, more efficient, and frankly, a lot fairer for everyone. At the end of the day, this isn't just some dusty academic paper. It's a real-world guide. It's a roadmap for closing that frustrating gap between knowledge and action, and for building health systems that actually work for us. It's about making sure science doesn't just stay in a lab, but gets out there and makes a real difference. And that kind of leaves us with one final thought. Think about your own community for a second. What's one health policy or practice you've seen where you just wish it was guided a little more by the actual evidence? It's a pretty powerful question when you start to think about it.